how do you diagnose cystic fibrosis, and like when does this occur?
Okay, sure, that's a great question. So how do we diagnose, how do we figure out if a patient has cystic fibrosis? So there was a test that came out sort of like in the 40s and 50s and 60s of the last century, back in the old days for you guys. And what people realized was that people with cystic fibrosis tasted salty. And when you did their blood test, people noticed that their salt levels were low. And they go, wow, that's sort of weird. This kid has pneumonia, has a lung infection, and their blood shows that their salt is low. And then, so people started connecting the dots, and then somebody developed a test where you can measure how much salt is in a person's sweat. So that's what we call a sweat test. And so when we want to do, to see if somebody has cystic fibrosis, what we do is we bring them in, and there's a thing that looks sort of like a wristwatch. And on the back side of the wristwatch is a medication that makes the skin sweat more. And then there's a tiny little tube that by capillary action sucks up the fluid from the skin, and then we send that fluid to the laboratory, and they can measure how much salt is in it. So it's not that the kids with cystic fibrosis sweat more, it's that their sweat is saltier. And if the number is greater than 60, then you have cystic fibrosis. If the amount of salt in your sweat is below 40, then you don't have cystic fibrosis. And if it's between 40 and 60, it's sort of like a gray zone, not totally sure. So that's considered the main way to find out if somebody has cystic fibrosis. Now, things have changed over the last 20 years because now we have genetics. So you can take a blood test and you can look at the DNA in their blood, and you can figure out if somebody carries the genes for cystic fibrosis. And cystic fibrosis is interesting because you need to have one gene, one marker, one abnormality from mom, and one abnormality from the dad. You need to be it's a double hit. If you only have one abnormal gene, then you're considered a carrier, and it's and you don't have any illness, but you can pass that illness to your children. People with cystic fibrosis have two genes, and you can figure that out with the blood. So now we have a blood test and a sweat test, and a lot of times we do both. And then most patients get diagnosed in California, and actually all through the country. Now babies are tested for cystic fibrosis in the first day of life. They get a little pinprick to their heel, they draw some blood, and they run a bunch of tests. And one of the tests is looking for cystic fibrosis. And so most kids in California, you find out that they have cystic fibrosis within their first month of life. And some moms get a test while they're pregnant, and they have a test to find out if the baby has cystic fibrosis even before the baby is born. And some families are into that, some families aren't into that, because there's a little risk to doing that test. There's a risk on the pregnancy to doing that test.
And is that more common if they know they are carriers?
Exactly. So now, it used to be, nobody said, well, if you have it, it's sort of a crapshoot, it's a random thing, you just find out later. But now, with genetics and blood tests and a lot of medical advances, a lot of women are being tested while they're pregnant to find out if they're a carrier. Because if you're not a carrier, the baby can't get cystic fibrosis because they need mom to give one gene. So even if dad's a carrier, the kid can't get it because mom's not a carrier. And then if mom is a carrier, they usually then check dad. Is dad a carrier? Okay, and then if both of them are carriers, then you go, wow, there's sort of a 1 out of 4 chance that the baby will get 2, one from each. And then it's up to the parents to decide, do they want to be tested before the baby arrives? Some families want to know so they can sort of prepare. And then some families are like, that test to find out, it's sort of risky and we really don't want to put the baby at risk. So what we're going to do is we're just going to wait till the baby shows up, and then we'll do the testing then. So it's sort of a personal choice for certain families. And then there are some kids who they have sort of not typical cystic fibrosis, and so they don't show up until they're like 8, 9, 10, or even 15, because their cystic fibrosis isn't really acting like cystic fibrosis. Most people with cystic fibrosis, the classic picture of cystic fibrosis with lung issues and stomach and intestine issues and sweat issues, it's pretty clear while they're in preschool, sometimes even when they're like 2 months old. But some patients have a mild form of cystic fibrosis, so people don't really figure out that they have cystic fibrosis until they're like 10 or 12 or 15. And so something like that digestive problem, where they don't really digest fat, some people, they go, oh, I saw a doctor because I have a lot of stomach aches, but we don't really know why I'm having stomach aches. Or somebody might say, oh, I went to see a doctor because I keep getting sinus infections. And then it's so, but they don't have the whole picture. And so people don't think about cystic fibrosis. It's not until people start having like 1 or 2 or 3 problems and then people go, oh, you put all this together, it's cystic fibrosis. We should do those tests. So some people are still diagnosed later, like when they're older kids or teenagers or even adults. But more and more, because of blood tests and genetic screening and all this prenatal stuff, most people get discovered when they're babies.
Right.